Hi guys, welcome to another YouTube video from your favorite screen girl, your favorite psych nurse. In case you're just coming across my beautiful face for the first time, hello who? Hello who? You're the real OG. My name is Oluwafisayo Adeboboye and I am a mental health nurse and I reside in Manchester, United Kingdom. This channel is just about nursing, lifestyle, DIYs, just vlogs. We're just here to have fun. And if that sounds like something that appeals to you, you know what to do. Click the subscribe button and make sure you turn on your notification bell so that you get notified every time I post a new content. Without further ado, let's jump into today's video. We can all agree with me that nursing sometimes can be stressful, it can be overwhelming, and contrary to what people think that nursing is restricted to just bedside, that's a lie. There are other specialties that you can actually delve into that will take you away from the bedside, just in case you do not like bedside nursing anymore. So the first of my list is actually the school nurse. So these people are registered nurses, but they are specialized community public health nurses. So they work with school children, as the name implies, school health nurse. They work with school children. They teach them about their health, how to recognize signs of illnesses. They also do sex education. They also then train the teachers in order to empower them, because the teachers are actually more in contact with the children. Like, they are the first contact in the school with the children. They spend the most number of hours with the children, so they empower these teachers to be able to recognize signs of illnesses in children. So the only downside to this specialty of nursing is you get to work Monday to Friday. Like myself, I work, um, so take for example, in a week, I work three 12-hour long shift in a week, and another week I work four 12-hour long shift. So in this weeks, I know that in 1 week I've got 4 days to myself, except then I'm going to work overtime. And in another week I'm having 3 days to myself. But these people work Monday to Friday. Another good thing to eat though is that whenever school is not in session, then they're not in session. But I'm not really sure if they get paid for that. I'm not really sure. But if you're looking at moving away from the bedside, this is a very wonderful specialty of nursing that you can dive into. I think it's pretty chilled, if I'm being honest. The second on my list is the telehealth nurse. The good thing about this is most often than none, they usually work from home. Like, it's a remote kind of job. So if you want that extra flexibility with your time, probably you're a new mom, or you just want to work from home, you don't have that strength to always leave your house, you can actually delve into this nursing. So you can either work from home, you can work in the hospital, you can work in the telephone triage center, whatever appeals to you. But just know that you've got that flexibility to pick or to choose where you want to work from. So telehealth nursing is just about using telecommunication tools like your phone, the laptop, internet, a video call, text, to help improve a patient quality of health. I know some people might be wondering, like, what do you mean? So I would actually say this actually relates to like consultation, like an online consultation. I remember, like, some few weeks ago, when I was about to actually book an appointment for something, I was actually provided with the option of actually getting that initial assessment done from my house. And then I was like, oh, okay, yeah, that's chilled, because I felt I had to walk into the hospital or the clinic to actually have this initial assessment done. And then this medical practitioner actually just joined me via video call, sent me a link, I joined, and then initial assessment was done. So for nurses, you can actually do this. This is a very wonderful area of specialty. Also, if you do not enjoy bedside anymore. Next on my list is aesthetic nurse, and believe me, this is a very, very beautiful specialty in nursing. It is very, very beautiful. I think that it is one of those specialties that they do not really talk about, but this would actually help you take control of your life. Like, if you want to be your own boss, because you can actually have your clinic. And the beauty to this is also got like several other like mini specialties. So for aesthetic nursing, as the name implies, is like a beauty nurse. So they're the ones that do the Botox, the lip fillers, your body, laser pills, chemical pills, hair removal, and all of that. Yeah. So you can actually have your own clinic, you can have your own private practice, you can also be employed, but then you've got total control of your time, because this is how it works. So people that want to make use of your service then go online to book. You tell them when it's convenient for you to offer this service, and then you're in control whenever you want, wherever you want. Do you understand? And like I said, there are actually like subspecialties under aesthetic nursing. So we've got the prescriber. The prescriber are these people that can then go ahead to prescribe lip fillers, Botox injections, and all that. Like, even though you're an aesthetic nurse, there are some restrictions depending on your level of certification that you can do. And other people go as far as becoming cosmetic surgeons. As a nurse, believe me, you can actually do that. So these are the people that assist the doctors in theater. Probably people are having like BBL, they're having their, all those, my drift. So these people actually do that, and then they make cool money. In another video, I'm actually going to be I'm actually going to making a list of like nursing specialties, like with the top pay. Oh my god, because at the end of the day, aside the fact that we are going to school, we're going to universities to like acquire knowledge. Why are we acquiring the knowledge if we do not want to use that knowledge to then make money? So you would all agree with me that in the end goal is actually money, but then job satisfaction. Because believe me, there's some people that are actually in their current job, they're making the money, but they're not happy. They're mainly going to work because they've got bills to pay, they've got things that they need to use money to do. You get me? The next on my list is actually the nurse educator. This one I do not even need to dwell anymore. You already know by the name, nurse educator. So they are the people that you find in colleges, in universities, in teaching hospital. All they need or all they do is they teach nurses. They teach people that are aspiring to become nurses, or they already teach, or they teach people that are already nurses and they are just looking to like broaden the knowledge. Take for example where I work, the people that they call PDNs, the practice development nurse. These people, you can actually equate them to be nurse educators, because what they do now is they do like an audit, and then they're able to find out where nurses are actually lacking in knowledge, like in relation to their practice. And they organize trainings, they teach nurses, they empower nurses. This is actually a very good specialty. But for every specialty, there's also a downside. So I think if it's got to do with like a school, I'm sure it's going to be running from like a Monday to Friday, probably a 9 to 5, 8 to 4. And I do not really think most people want to be working that many days in a week. Do you understand? So I feel like that might be the disadvantage of this specialty in nursing. The next one on my list, they are very, very popular. Shout out to all my public health nurses out there. I do not even need to I do not need to buttress on this. Public health nurses, these are the people that make sure that they are able to contain infection outbreak in the community. They make sure that we achieve optimum health through community participation and all that drift. The next on my list, if not because I was making my research into this topic, I wouldn't even have stumbled upon this particular specialty. They're actually nursing informatics. Like, I didn't even know anything like that existed until when I was actually doing this research. Yeah, so nurse informatics, they are people that actually incorporate nursing, computer, and information to bring about a change in people's health. So they're a field of nursing that incorporates nursing, computer, and information science, and they also manage medical data. Like, they interpret this data into information that then can be helpful in the treatment of illnesses, in the improvement of patients' lives. Like, at the end of the day, the end goal of nursing is to either alleviate suffering, promote your level of health and well-being. Do you understand? So I feel that it's a very interesting field of nursing, because I'm trying to like think in my head how they actually do this. Like, it's actually a field that is worth exploring. I do not really have like a lot of idea about this, so I'm not really sure as at the time of making this video if there are any downside to this specialty of nursing. But like I said previously, there is no specialty that would not have their own downside. The next one, oh my god, legal nurse consultant. My nurses, please, here is the time. Like, I do not want people to start thinking, oh, if you become a nurse, you're only stuck in the hospital on the wards. No, there. I'm sure that even beyond this 10 non-bedside specialties that I am listing, there are like hundreds more that we've not even discovered. But legal nurse consultants, like this is mind blowing. Like it is mind blowing. And what these people do, they work alongside attorneys to make them understand medical terminologies and also to break down. I remember when I was in school of nursing and then I was on um my forensic posting. Oh my god, I saw a lot of things. So there was this person in court. I think she had a case then, and from the evidences that was supplied by the defendants and the, I don't know what they call the other one, but the plaintiff, yeah, the plaintiff, the evidences, I think it was already drifting towards the side of this lady is actually guilty. And then she became hysteric. She started like feigning sickness, so she had an asthmatic attack and all that and all that. Because prior to that, I was wondering, like, why would you send nurses to the courts, like what is it that I'm doing in the courts? But then at that point there was, I think it was a nurse, but I'm sure it was a medical practitioner that actually came there, did an assessment, evaluated this woman and concluded that she was fit to continue with her trial and actually take a course in this specialty to become a legal nurse consultant. Anyways, I hope you guys are catching it. I hope you guys are jotting things down. Next on my list is diabetes educator. And we know there are people that get referred to diabetic clinic. And I feel that with diabetes is actually a whole lot of work because you do not just help them to look out for the signs of hypo and hyperglycemia. You do not just help them to like to empower them to know how to do their insulin. You also need to teach them about food care because if there is nothing that we know about diabetes, we know that people with diabetes, their wounds take really, really long to heal. And in that process, we do not want anything like infection or whatever. So all this information are the things that a nurse educate, a diabetes educator, pardon me, a diabetes educator would then empower these patients with and also their families with so that they are equipped and then they can also manage their life and improve the quality of their health. The next on my list is a very, very interesting one, is called the lactation consultant. Yeah, I feel that this specialty, like to be really, really honest, this is the first time um I am actually learning about this. Like you all know, I am a new mom. I've got a 6-month-old baby. And when I was in the hospital for the first few days, I actually struggled with breastfeeding my baby. But in the space of that time, the only thing I heard is, oh, if you're having struggles, we can teach you how to do it. Like no one actually went to say, oh, we've actually got people that are actually specialists in this field that could help you. So all they teach you is how to actually maintain good position because believe me, in the first few weeks when I was breastfeeding, I would sit on the chair, no support. I'd carry my baby in a very funny way, and at the end of the day, I realized that I came down with very, very terrible back pain. So they teach you about what to do to increase breast milk supply, how to maintain cleanliness of your breast, how to cope with sore nipples because that thing is painful, my guys. That thing is painful. I remember breastfeeding my baby one day, and as soon as it lashed on my nipples, like I was crying because it was that painful. So these people would empower you with tips that you can use to deal with sore nipples, how to prevent it, correct breastfeeding positions. Do you understand? Last but not the least, they are the nurse case managers. They are the nurse case managers. So what these people do is just they work with patients, they work with families, they work with the staff that work directly with the patient just to improve their quality of life, you would say that there is something really particular to all these specialties that I have mentioned. And it only brings me to the fact that either bedside or not bedside, we have the same goal at the end. We want to improve our patients' overall well being. If you've watched me to this point, believe me, you're the real OG. Thank you guys for always showing me love. Thank you so much. I really appreciate the love. I appreciate the comments, the likes, the views, and we know that we can do better. I really appreciate all the love, like I said before. Till I come your way another time, I remain your favorite screen girl, your favorite psych nurse, Oluwafisayomi Adeboboye. Bye, guys.